Beyond diet and lifestyle changes, the reduction in weight can also be achieved using procedures. One of the procedures is a laparoscopic surgery that we do in GNL surgical. These procedures require a set of rules or guidelines from the Ministry of Health that we follow. The guidelines among the guidelines, they do include a body mass index criteria. The second part of procedural weight loss would include endoscopic weight loss. During the endoscopy, we do insert a balloon. After we do an endoscopy, we look at the esophagus and stomach to ensure that there is no issues within the esophagus and stomach, like any lumps or ulcers. Thereafter, we insert a deflated balloon through the mouth into the stomach and we inflate the balloon. These two procedures will be done under sedation, where another doctor and anesthetist will give you enough medication to put you to a deep sleep so that you do not feel any discomfort. Subsequently, the balloon is kept in place for at least 6 months, and thereafter, after 6 months, also under sedation and also with the aid of a gastroscopy, the balloon is removed. The average weight loss is usually 15% of your weight. For example, if you're 80 kilograms, you can expect to lose at least 10 to 12 kilos within the 6 months. Okay, during the 6 months, it is imperative that number one, you see the doctor regularly, and number two, you strictly follow the diet and lifestyle advice given to you. What to expect immediately after the procedure? A little bit of discomfort and a little bit of nausea. This is expected because there is a foreign body or a balloon within the stomach, and it takes a few hours to a few days for the stomach to get used to a foreign body or balloon present in your stomach. Commonly, what the stomach does is to squeeze, to push the balloon either upwards or downwards or down to the small intestine. But this effect usually goes off after any time between a few hours to 3 days post-procedure. During this period, and advised for at least 2 weeks post-procedure, you should take a liquid diet only, which will include soups and beverages without milk or sugar. During these 2 weeks, two effects will occur. Firstly, the stomach gets used to the balloon and you'll have a much better recovery post-procedure. Secondly, the greatest weight loss is within these 2 to 4 weeks immediately after the procedure. Okay. Subsequently, you'll be advised on a low carbohydrate or low sugar diet and a low fat diet, and slowly you'll increase your fiber. Exercise can also be started soon after the procedure is done, for example 1 to 2 weeks, once the stomach gets used to the balloon in place. The biggest fear post 6 months is that after the balloon is removed, many people fear that their weight will have gone up. That's the reason for these 6 months to be closely followed up by the doctor. After inculcating a proper diet and lifestyle changes in your life for 6 months, you develop a habit, and that is the aim of the doctor in GNL clinic, to help you inculcate this diet and lifestyle habit so that with or without the balloon you continue. Also, the doctor's voice, which you have heard repeatedly over these 6 months, will come to you even after these 6 months when you look at anything that is not supposed to be consumed. That will also help